Dr. Richard Besser is the former acting director of the CDC. He's also president of the Robert Wood Johnson Foundation. And we should mention, while the foundation holds stock in Johnson & Johnson, it is an independent entity. And Dr. Besser, good to note that, because Johnson & Johnson is where we start this morning. It's rolling out again. How do you see this playing out? How much damage was done by this pause?
Well, Savannah, it's definitely going to take some work. I think the pause was the right way to go. When vaccines were first authorized by the FDA, they had been tested and well tested, but only in tens of thousands of people. So there could be very rare side effects that you don't see until they're in millions of people. And we're counting on the vaccine safety systems to pick that up, and when they see a signal, to take action. And the review panel, I watched the committee hearings on Friday. They asked tough questions, but there was an overwhelming sense that the risk from COVID itself to ourselves, to our families, to our communities far outweighs the small risk from the one-dose vaccine. How
do you convince people? We have this new poll. 19% said that they would not get the vaccine or only if required, and 15% are still in a wait-and-see mode. When you're saying, look, sometimes we do have to wait and see if there's going to be any other side effects that come up. How do you counter that argument for people who think, well, I'll just wait?
Yeah, I don't think we're going to be seeing those 3 million doses a day numbers like we saw before, because states have caught up with the people who are really eager to get vaccinated. I think we're going to continue to see an increased number of people getting vaccinated, but it's going to be a slower trickle. And we have to do everything we can to understand why different groups are hesitant and not lump everyone together. Some people are hesitant because they may have a medical problem. Some people are hesitant because they can't take time off work to get vaccinated. If we can make it as easy as possible for people to get vaccinated and to help people understand what the benefits are, and it's not just the personal benefit, if we can stop transmission in communities, we're much less likely to see new variants arise that could actually not be covered by the current vaccines.
Well, on that subject, there was a report over the weekend in the New York Times that about 8% have missed their second dose of the vaccine. Now, the CDC says the real number is a bit lower than that. But what is the implication of that, especially when you're talking about variants?
Well, it points to the importance of having a one-dose vaccine. You always see some tail off in terms of people coming back for the second dose. As a pediatrician, we do a lot of catch-up vaccination. We need to really understand, though, why are people not coming back? Is it because their arm was sore after the first dose? Or is it because they can't take time off work, that there's no vaccines available close to them, that the appointments aren't as convenient as they thought they were going to be? We have to break it down and understand, and then put the resources in to address all of those concerns. There is some protection from one dose, but the important thing to know is that we don't know how long that lasts. And the level of protection, the amount of those protective factors, the antibodies, is lower if you just get one dose.
Yeah, and the potential for variants that could evade the vaccine as well. Richard Besser, thank you very much. Always good to have you with us.
It's a pleasure.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.